There's definitely been a a lot of variation, I'd say, especially in laboratory courses with the type of teaching from home they've been trying to do. Some virtual simulations, some actual like experiment kits that folks have been using to supplement the lectures, the Zoom meetings and stuff. I'd be curious if anyone has actually tried to influence safety when it comes to those types of at-home research kits or experiment kits.
Yeah, it looks like Alyssa has at Penn State. Hey, Alyssa, let me know if you'd like. I can unmute you if you want to give us a quick share about that. Yeah, Kimmy and Brandy also talking about using those kits at Penn State. Great. All right, give me one sec here, and let's see. This is actually going to be my first time ever doing this, so let's go ahead and see if this is going to work here. Let's see. I've never actually done this before, so this is going to be a new thing for me. All right, Alyssa, I'm giving you permission to talk here. Looks like you're muted right now.
Okay, new experience for me too. So my name's Alyssa. I'm with Penn State University. We have been reviewing kits as a group within our office in terms, and I see somebody commented about fume hoods and eye washes. That's part of what we take into account in our assessment. So if we don't think that they could safely do the work at home, whether it be waste disposal, potential exposure concerns, anything along those lines, then we tell them they can't use it. So for example, one of the kits from Carolina Biological, pretty standard, you could probably do it in a high school lab, but we felt that it had too many potential allergens and a corrosive in the kit that we didn't feel comfortable with them doing it at home. So that's the approach that we've taken.
If you guys ever see me kind of doing this, I have another computer out here I'm taking notes on because I'm expecting to get a lot of great webinar topics and ideas from these things. So I think maybe a future webinar on a kit at-home kits might be great. And thanks for sharing that. Oh, got it. Kimmy, did you want to jump in? It looks like you guys have something different to add. Or Brandy, I know you mentioned these kits as well. Just kind of catching up on the chat to see if I missed anybody else who might have something to share here. It looks like Susan's investigating the kits for Rowan. And yeah, Jay mentioned, okay, great. Hey, yeah, Kimmy, I'm going to go ahead and give you a chance to speak here. All right, you should be good to go.
I'll mute myself. Okay, I raised my hand. I didn't know if that would work. Yeah, I just, to add to the review of the at-home kits, what we did is we took actually we talked a bit to Alyssa at Penn State, I think, but also we took a form that we have for reviewing lecture demonstrations, like a hazard assessment recommendation form. We adapted that so that any of the courses that want to do at-home experiments, whether it's a kit from like Carolina or some kind of kitchen chemistry, they submit it to us and then we fill out that form. Mostly it's just documenting the inherent risk mitigation or controls, you know, small scale, and then we might make additional recommendations if they're needed, and then we provide that back to the instructor. So our role is mostly in helping them document what they're doing to keep the students safe. And then we also developed a kind of a safety contract for the students to sign and have their guardian or homeowner, leaseholder, if applicable, sign that as well. So that's what we've done.
And here we are at 3:05. So thank you, everybody, for joining us today. Our webinar is going to go ahead and begin now. So this is our kickoff webinar in this new series. You're going to see me looking up a little bit. That's because I have a secondary monitor up there. This is the BioRAFT EHS community webinar series. Our goal here is to really provide a regular place to have more focused conversations on some really important issues that are affecting EHS right now. With the advent of coronavirus and COVID, it seems like everybody's just been catapulted onto the bleeding edge of safety all of a sudden. And there's this huge need for information and for reestablishing and finding new best practices. And that the more we can talk and share knowledge, the faster we can get to those best practices and keep people safe. So we've got this really fantastic, diverse group of panelists here today with me to share their knowledge with you and just answer some questions, answer your questions. There's going to be a really, hopefully engaging Q&A partway through this webinar. You'll notice in your Zoom webinar control panel, there is a Q&A button. So you can hit that and you'll have a different place to ask questions in the webinar. These will be, as you'll see, as you kind of like get these questions answered and asked, you can thumbs up them. So that way you can help the questions that you like rise to the top and we can address those with a greater priority. And you can also comment on other people's questions, have side discussions, and that way we can just sort of keep all this information coming and have a greater volume of conversation. And we really appreciate everybody joining. These are really intended to be engaging and discussion-based. So while we have these panelists here to help share their information with us, this is also about you. And please feel free to ask any questions. And Mary with the first Q&A. So that's, yeah, Mary, there was a reason you didn't see any questions. You got the first one. So I'm going to mark that as answered live. And now it should be available in the answered portion of the Q&A for everybody. And I'm going to hit done. And there you go. So feel free to ask questions as we go. We're going to go ahead and prompt those later. And without any further ado, I'm going to go ahead and kick things off with our panelists. So we'll just go down the line introducing everybody. So Sylvie, if you wouldn't mind giving a quick introduction of yourself.
Yes, so hi, so I'm Sylvie Blondelle. I'm at the Sanford Burnham Prebys Medical Discovery Institute in La Jolla, which is close to San Diego, in California. I'm in charge of the biosafety program, but I'm also involved with all the research compliance, meaning the IBC, IRB, stem cell committee, ICOC. So I'm helping all the researchers. So we are an institution which is a private research institution with about 600 researchers. We have BSL-3, of course, busy now with all the COVID-19 research. And we don't have any classes, so I don't have to deal with students. And I know there's a lot of questions for that. So I think that's it.
All right, great, thank you. And Jack?
Yeah, hi, I'm Jack Bracken. I am the Chemical Safety Project Manager at UCLA. Couple of things that I guess I work on a regular basis is increasing customer engagement for all of research safety. So all of our research community, trying to get them engaged with safety, as well as creating new content to support all of the safety efforts that we do on campus with our researchers. And yeah, and like I said in my bio, in my free time, I'm also a chemical and biological sciences tutor. So yeah, really a big fan of you know, helping people learn and educating and sharing and learning myself. So hope this will be fun.
All right, Sean?
Hi, I'm Sean Fitzgerald. I'm the biosafety officer and chair of the IBC for Hackensack Meridian Health. My background, it started out doing a lot of drug and vaccine research development. That transitioned into a safety role, and that's sort of blossomed a lot with select agents at a few different institutions. I moved here as part of the beginning of starting up a more robust research program here at Hackensack Meridian Health. It's a large health network up in New Jersey. They wanted to get into sort of translational research, recruited a lot of researchers. We've got about 20 PIs right now, supporting a large institution with about 3 BSL-3s right now, soon to be a 4th. A lot of different diverse research here, a lot of drug development, and obviously a huge shift into COVID-19 and all aspects of it, both here in the research end, but also in the hospital and patient care end too. So it's definitely been an interesting intersection for me.
Great. And last but certainly not least, we got Jonathan Klane with us here today.
Thanks, Matt. Hey, Jonathan Clayne, Director of Strategic Change and Safety Culture. Bald-headed safety culture guy. Seems to work much easier than that. I work for the College of Engineering at UC Davis. I'm not in the EH&S department, although I love working with everyone in our EHS and safety services departments. Awesome, awesome teams. So I'm an embedded safety professional. Background includes teaching for a number of years, being a consultant, as well as being embedded now. And so I really focus on two things besides the obvious safety culture, and but it's related. It's really effectiveness. How can we be effective? What are we trying to accomplish? What is the outcome that we want? And towards that end, I will honestly tell you that it's often efficiencies get in the way or cause other problems. And then also just how do we do this? You know, what's this going to take? So getting away from the generic to the specific for our people. What is it going to take to really make this happen? And when I'm not hanging out with the crew from Galaxy Quest, which is always a lot of fun, I engage both research and for fun in the use of creative nonfiction as well as fiction in affecting our risk perceptions.
Great. And then just a bit about me. My name is Matt Siegel. I work here at BioRAFT, and I'll be the MC for today's webinar. I worked in Boston Children's Hospital. I have a background in stem cell biology and epigenetics, not epidemiology, although that would be very topical. And I just came here as a safety guy in my lab and really loved the company and the mission. And I've been working here ever since. And one of the nice things that this whole pandemic has given me is a way of rediscovering my love of cooking and also 3D printing. So I've got a printer right next to my desk, and I get to print some cool stuff once in a while, like this little vase. And yeah, I'm just really excited to get to meet all of you, meet all of you, and share this information. So without any further ado, we can get started. And I'll kick the first question over to you, Jack. So first question here that I have is, how have you been managing inspections? And what have you enacted in terms of any new practices to get active researchers more engaged in managing their own safety?
Yeah, thank you. That's a great question. You know, initially when the ramp down order came to us from leadership at UCLA, you know, we had to suspend pretty quickly all of our normal lab inspections. However, we were lucky in that during the last 3 years, we've actually been utilizing what we call a safety checkup process for our researchers. And this has been a substitute, you know, every 2 or 3 years for our traditional inspections. And it involves going to the lab's group meeting and sitting down with all of the members of the lab and having a candid and thorough discussion about risk perception, you know, the support that they receive from EH&S and the university during, you know, their normal operations. We were able to actually pivot pretty quickly then into using this same methodology, this process for the active labs, the ones that were doing essential research, who either just maintenance of animal, you know, animal husbandry type of maintenance, or equipment maintenance, or actually doing COVID-19 research. And so we were able to set up Zoom meetings with many of these labs, have conversations about how they were, you know, working through this particular crisis, but also just, you know, their general safety concerns to kind of keep up with the everyday workload. It's great because it allows us to continue to support them remotely. It keeps us engaged with them, the whole research community. And, you know, we actually get a lot of interesting things that we normally wouldn't pick up on in a normal safety inspection, right? People will come and tell us things. Maybe those aren't the people that we normally would talk to during an inspection. And so we get this great insight into like some of the real like dynamics inside the laboratory. And since we implemented this, we've had some rigorous training for all of our staff to get them to, you know, become proficient in managing these types of meetings. So all of that training and stuff is paying off now because we're able to translate that pretty easily into this current environment. So that's been, I think, a great success. It's really overperformed for us. You know, there's still some value, obviously, to getting eyes into the laboratory, but, you know, in the current situation, I think this is really paying off.
Fantastic. Have any of you other panelists had an experience like this or have anything set up similarly where you'll have these self-inspections leading to insights or other things that might translate over to new labs or other groups? Yeah, Sean?
Yeah, certainly. So we've had a lot of, it's not always an equal process, right? I think some labs are a little bit more catered to a safety perspective than others. So it's been easier with some labs sort of managing that process than others, but it's more of trying to sort of unite everyone in that idea and that thought process and sort of pair people together and pair sort of those better self-starters with people sort of thrust in that role in other laboratories. And we've definitely had success with that even before the pandemic started, just trying to get that sort of culture of safety built up in some of these laboratories. And, you know, it seems like it's been a more of the seasoned, you know, veteran lab managers, but they've been able to sort of help build that culture and really grow it in our institute here, at least.
Great. No.
So in our case, because again, we are smaller, and we are the EHS people, and myself including, on site. Basically, we never left. So we've been there every day almost. I mean, I've been working like 3 or 4 days a week on site, and then the rest at home. So we're still like walking through the labs that are active. So we haven't changed anything because we were on site with them. So we just did the same thing that we did. The only thing that we changed, like now that we're ramping up like the researcher to come back, we really asked the PIs and the manager to send us like their plan, okay, and then we go to talk to them or we Zoom with them to make sure that their plan will be good, like to make sure that we keep everything like the distancing, like the safety and everything is really well included in the plan. So that makes them think more than in the past, because they have to write it and to submit it, and it's been reviewed by a committee.
Yeah, and in our case, just to add a teeny bit, our EHS partners, our lab safety professionals, are doing whatever portions of the inspection they can virtually at a reduced but ongoing level. And then for any of our operations that did receive approval, typically COVID-19 related, then either someone like a department safety coordinator or laboratory manager or whomever are typically checking up, checking in, seeing how things are going. Not really a formal inspection per se, but really just making sure things are going the way that they should be going.
Yeah, I'll also add that in our BSL-3 facility, where a lot of the most high-risk COVID-19 research is going on, we have someone on site supporting that, pretty much all day. Their work schedule has not changed, but yeah, there's certainly a wide variety of activities that some would certainly require a little bit more hands-on interaction. But for the most part, we've been able to support that with minimal troops on the ground, so to speak, and the rest of us from home, kind of support as much as possible.
Got it. Well, this seems like a good chance to kind of take another step forward in this direction. And Sylvie, I was wondering what you've been doing as you've decided to bring researchers back on campus or onto your facilities, and determining who gets to come back and how you may communicate to people that they're not ready to come back, and maybe get people who think they're ready or important enough, but where their research may not quite align.
Yeah, that has been a challenge, to tell people you're not important enough and others you're important enough. So you have to be really diplomatic. But basically what happened is that at the beginning, we only have COVID-19 related research, so either in the BSL-3 or we also have some BSL-2 lab when they're not working with the live virus, but they have something that would be related. But beside the true COVID-19 virus that the PI had to submit a proposal, like basically almost like a grant proposal, but much shorter, and with the safety included in it. And that went to our president and like another committee, kind of like a leadership, like a scientific leadership, to make sure that it was really important to do. And then they was like passed on to me and another upper management committee, that we were then reviewing the safety aspect and then working with the lab to make sure that everything was going to be working like smoothly. So we had a few labs that we accepted like that, but since this week, we are just starting to ramp up, and now it's like everybody can come back as long as they have like all the safety, like with the distancing. So basically labs have to, like the plan I was proposing, talking about that they proposed like having shifts, or if they didn't know, and we're moving some equipment around and things like that to make sure that everybody can be accommodated. And so we are ramping up like slowly, but they can do whatever research now that they want to, because we can open as a life science. We had an order that by our public health and county that we can open again with like certain restrictions. So we are implementing those restrictions. So this week is pretty slow, but it's getting more and more, because every time we are implementing, we make sure that we have all the safety implemented. And we had what we call a coronavirus info task force, and we have been communicating to all by email, like at least twice a week since the shutdown, to make sure that we're telling them what's going on and who can come back and how we do that. And then there was specific communication to PIs also if they have to do something else. So there's been a lot of communication by email or by Zoom. Also, there's also a task force like from the faculty, and I was on it too, to kind of discuss more their point of view and not just like the support group. So we had a lot of cross interaction like that.
And just a quick follow-up here. I was curious, did you encounter any feedback that you were surprised by from these faculty group meetings or perspectives that you hadn't anticipated?
Yes, actually, there was kind of a surprise that, so one day they say they want to do everything we can to come back to work. And then when we set up this safety feature, and I say, well, maybe it's not enough, maybe we need to do more. And then they were adding some ideas. So it's kind of like they want to come, and the next day they say, well, but wait a minute, maybe I don't want to come. So if not everything is there. So that's why it's been a slow process and and I think it was good to have this communication and not just like one group deciding, okay, we need to do that, but like a back and forth. So then it was like really important to have those feedback, because not one group can think of everything. So that did help, definitely.
Sean, Jack, John, any of you guys had experiences with having people come back on and then having to have some difficult conversations around permissions there?
Yeah, plenty in our institution. You know, we've had a lot of personnel that, you know, we had a very quick initial sort of ramp down when everything really hit very hard. But, you know, there was a very quick push to jump back into research specifically focused on different aspects of the current pandemic. So it was definitely a quick process that's had to be ever moving to sort of try and address, you know, how this can work. How can we make sure that people are staying safe while also making sure that they're taking part and supporting this extremely valuable and important timely research. So it's definitely been a difficult process, and had to have some very difficult conversations with people, but I think it's an ever-changing and ever-moving process. And I think that's been the important part, is that people are constantly evolving, constantly moving, and constantly shifting their process to make sure that they're adhering to all these things while also being successful in their research.
Yeah, the other thing I forgot also to mention is that definitely because we only have one BSL-3 lab, then people say, okay, I want to be trained. So we have to push back on that. There's no way I can train someone that has never worked with the virus in a week. So then there have been some disappointment in that sense, but they say, no, we can't. And we don't have the lab is too small anyway to accommodate everybody, and then there's no way we can do training, I mean, safely. So there was some pushback there also, of course.
Jack, it looked like you had a response as well.
I was gonna kind of agree with Sean and Sylvie both. So definitely our BSL-3 facility has gotten a lot more interest, you know, in the last few months. And so, there's a pretty strict vetting process to see, what kind of research can be done in there. And of course, a significant amount of training that our high containment director is, handling, with, obviously a little bit of a time lag for those researchers who want to get set up, but, it's necessary really, because this is the most high risk type of work we have. We have had to have some inquiries, I guess, into, a couple of labs that we had talked to who were, doing some work, and there's always a little bit of, I would say, of a time delay in in the information coming from the departments as to who's been approved for research and when it gets to us. So, we had to kind of clarify some things and make sure that the labs that appear to be still doing work have been on the list of essential labs for us. So some difficult conversations there, touch and go, but usually we sort it out by just pointing them in the right direction to do things in the through the proper channels. And so it's worked out so far. We haven't had anything kind of blow up on us at all with regards to upset customers or anything like that.
Great. So just a quick thing before we jump to our next question here. I wanted to remind everybody that we have a Q&A panel here in Zoom webinar. So this is a great place to ask your questions so they don't get lost in the chat. There's a thumbs up feature so we can help bubble the questions that people are most interested in to the top so we can address those more quickly. And you should also have the ability to respond to each other's questions. If you see somebody's question and you think, oh, I've got something I'd like to build off of that, or an answer or another request for information, you are welcome to add comments to each other's questions there as well. And we're going to spend some time in the second half or third of the webinar addressing those questions. And looking at the top question here about social distancing, this is, I think, a great time to get John's perspective here on that exact topic. So John, what steps have you taken to develop, educate around, and enforce policies for social distancing? Mask wearing, physical space use, what's worked, what hasn't? Have there been anything in particular that's just been very effective or maybe was surprisingly ineffective?
Or a mix of those two, right, Matt? Yeah, so thanks. It's a really good question. It's a tough struggle. What we've been doing is using mostly guidance documents. And so I, again, want to remind folks, I'm not in our EH&S group. I'm an embedded safety professional within the College of Engineering. So I'm only responsible for the College of Engineering, which is more than enough, trust me. So, so we've done a series of these guidance documents, really trying to use that new catchphrase, brevity is wit, and not get into a lot of detail and weeds, but to give people a good idea of the direction to go. So let me give you a couple of examples here. So one was, how do you write a new proposal for working in a lab and engaging in, and I won't call it social distancing if you don't mind, I'm gonna call it separation, because one way, it seems to be the most common so far to separate is not by physical distance, it's by time. I'm only gonna have, this person in this lab at this time, right? It brings up other things like working alone, but so far that's been easy to develop other strategies around. So the big 4 plus working alone. So separation and disinfecting of surfaces and cleaning or disinfecting of hands, so personal hygiene, and then cloth face coverings plus PPE, and differentiating that a cloth face covering is not considered to be PPE, as I think all of us would likely agree with some discussion. So we've done that, it's worked pretty well. There's been some level of confusion. Some PIs want to put a ton of detail in and struggle with brevity is wit, that I really only want to see the specifics of those 4 items for our concerns so we can really understand what they're doing. Other guidance documents are on things like the use of conference rooms and building spaces, one on the cloth face coverings, one on the use of the conference room for grad students who are doing qualifying exams, and how do we get them in, do their thing, disinfect, get them out, and that's been working well as well. And then a timeline and a process to be bringing people back on campus. It has not all gone wonderfully well. There's been a lot of confusion. So communication continues to always be kind of the biggest challenge.
Great. And then just a quick follow-up. What do you do in terms of enforcement if it seems like folks aren't really taking this too seriously?
Yeah, well, as the safety culture guy, I don't really do enforcement. I have discussions with people. And I've been talking with our other safety officers, both in engineering and outside, on one-on-one basis and small groups, and really encouraging the discussions. Other people, Jack, Sean, Sylvie, have all mentioned having conversations. Look, we're all under a tremendous amount of stress. People are really stressed out, short fuses. We see the usual stuff from that. So how do we have a constructive conversation, right? A difficult one or whatever, and really frame it around that this is really all about culture. I keep having people say, oh my God, this is your time, John. It's culture time, right? So it is really all about culture. I'm not wearing this. Yeah, I'm not wearing this for me. I'm wearing it for everyone else around me. Whether it's working 100% or not, I'm giving them a feeling of I'm in it for them. I'm doing this. I'm contributing to the greater good. Now, the what's in it for me is always going to apply. That's the nature of us as humans. And so what I've encouraged our people to frame it around, if it's a researcher, be it PI or grad student, is we're all over the place on risk perceptions, from I think this is all BS to I'm not leaving my house because I think I'm going to die the second I go outside.
Yeah.
And that's not really an exaggeration, sadly. But if we frame it instead, because that's too arguable, right? Too mushy in the middle. Instead, I've encouraged them to really frame it around threat to value. And what's the greatest value for a researcher, PI grad student? It's the research. So imagine that their research gets impacted. Imagine it gets shut down. Imagine that a floor gets shut down. Imagine that someone tests positive, that it looks bad, that this happens, that happens. Not so much their health and safety, although if that's what they want to say, yeah, let's talk. But let's talk about what really matters to them, their research, and what the negative impact could be. So everyone on the floor, in the department, in the campus needs to contribute to everyone's successful research. And we feel that that's a pretty good, successful way of framing it.
Great. Yeah, I agree completely. In my own experiences, just trying to tell to my friends about why they should wear masks, why they should be taken seriously, how to approach all the different information they have. Just helping to remind people about how it's in their own interest and the interests of others has been, I found, a very effective, very human way of connecting with people and helping to make them a little bit disarmed and more receptive to information that they may not be willing to encounter. And so Brandy, I'm just gonna go ahead and mark your question answered here. I think that we've covered all of those items, but please let me know if there are still some things in there that we didn't actually address. And before we get on to the Q&A portion here, Sean, I wanted to ask you a question because I know that your experience here also bridges into the healthcare side. So how do you manage requests from, oh, I'm sorry, looks like I'm reading the wrong part of this. So how do you approach the challenge of helping researchers and clinicians feel safe returning to work in the face of all the unknowns in the new COVID world and the new COVID research environment? And maybe also give us a quick brief reminder here about the organization you work at, just for the context.
Sure, yeah. So just for the context, I work for Hackensack Meridian Health. It's one of the largest hospital networks in the state of New Jersey. With 17 hospitals, 500 facilities, 40,000 employees, a massive sort of pillar for healthcare in the state of New Jersey. And, at the beginning of this thing, if, we take a step back a few months, there wasn't, research was over here. We were kind of on the edge of things. People's memories of things like Ebola, swine flu, things like that, they were still there, but it wasn't something pressing in the forefront. When this all hit, it became very, very important that we were sort of jumping into the fray and really trying to help support the hospital network, the state of New Jersey, but also the research and everything too. So one of our pillar lab groups had a lot of experience in the first SARS outbreak at a previous institution. And they were very quick to develop a PCR, real-time assay, to identify the actual virus in patients. Very early to get emergency use authorization for the FDA, and we were quick to sort of roll that out in the hospital. that also allowed me to have an avenue to sort of get into the clinical environment and sort of help that out. So my role was sort of twofold. You know, our network being this large is very much at its nascent stages. So at the beginning of this, we had a very large emergency response activity going and a huge command center that was built out that involved many different arms. And one of the arms that I was sort of thrust in to help with was chairing the laboratory response committee. And it wasn't just from the research end of things, but also from our clinical laboratories at all of our sites. Hospitals are all different sizes, all different capacities. So we sort of had to unify how we were responding, how that piece was going together. And I think from my research laboratory experience, it gave me a different way to sort of tackle the risk assessment process. We've had wonderful information provided to us from the CDC, the World Health Organization. Many of my colleagues, many of them I'm sure are sitting here on this webinar right now, you know, pulling that together and then putting that in a digestible format for clinical laboratory workers. It's sort of a different grouping. You know, they're used to, you know, assays that they're very much on precision, assays they run all the time. It's sort of not, it's a very different type of laboratorian. So it was a sort of different mindset to have to put the thought process in of risk assessment and how to convey that risk. To give the anecdotal idea here too, when I started rolling out these guidelines, I went to one of these hospitals and I started sort of doing these pop-up interactive risk assessment talks really. So it was sort of a pop-up background on SARS-CoV-2 and then a little bit of a Q&A. And then that sort of blossomed. And then I'd say probably about 15 talks later, I'd conquered pretty much that entire hospital, all shifts, all hours, and then moved on to a few of the other hospitals. So it's been sort of finding a way to convey research risk in a lot of ways to the hospital environment, because a lot of the assays they were running, a lot of the processes they were running, you know, present new and differing and different aspects of risk that needed to be mitigated appropriately. And then that also gave me a good window too into how to adapt that into the ever-growing research environment. You know, we have biosafety level 3 laboratories, a lot focused on different aspects of SARS-CoV-2 research, but we also have a lot of other laboratories focusing on different clinical aspects of everything too. So it's a marriage of trying to get the two groups on the same page in regards to the virus, but also finding a way to sort of make sure that that risk assessment is tailored to the clinical laboratory assays that they're running, the sample handling they're doing, the processing they're doing, but then also have that be able to be translated easily to the research environment, to the different research tasks they're doing, and then, you know, working with the specific virus itself. So I think that was a big piece there. The other big piece, and just to sort of dovetail off of a little bit of what Jonathan mentioned too, with setting that culture piece, is also being present in these environments, being present in these areas. The first time they're running an extraction on their automated platform at the hospital, I was there. The first time they're working with this stuff in the biosafety 3 environment, I was there, right there next to them, hands-on. So it's been a very valuable tool for me to be present and be available in those situations and really be there to sort of help the risk assessment process from a hands-on standpoint also. And I think that's been the really valuable task in this whole process.
Great. Yeah. Okay, so quickly before we move on to the Q&A portion, because I can see we've already got a lot of questions here and have about 20 minutes left. I'd like to do one very quick round the horn for each of you, maybe 1 minute. What is something that you've built into your daily routine that's been nourishing for you? Sylvie?
Oops. I think to me, it's like to communicate and release basically the frustration with my coworker that have the same frustration as me. I mean, we've been like helping each other. We find, I mean, in fact, we just like got to work more together, and that we got like this friendship also in a way and support each other, and that helped a lot.
Jack?
Well, especially for most of my office that happens to be working at home, we miss a lot of that, those random conversations, that water cooler talk. So we're working in a virtual environment, but we have posted daily polls on random topics of interest, like, who's the greatest TV mom of all time, or what's the right amount of denim based off of, Mother's Day, obviously, and National Denim Day, if you guys missed it a couple weeks ago. And it's just stimulated great conversations and a lot of fun banter. And I think that's keeping morale at a pretty high level, considering the situation. So that's been a lot of fun for our office interactions and for everybody's mental health.
Yeah. Sean?
I think, building that camaraderie with people that are, working day in, day out on this stuff. It's people that, hadn't a chance to really build relationships with before, because we're moving in so many different directions. So I think that's been good to have that. And also, a shout out for ABSA too. The listserv has been wonderful, seeing a lot of good comments and everyone sort of diving in the fray from a safety standpoint. It shows you, it always reinforces the fact that you're never alone in these scenarios and that everyone's in this together, fighting the good fight. So it's a really good thing.
Great. And John?
Yeah, so 3 quick things. I'm actually on campus, and my counterpart on the facility side for engineering, not ironically, is right next door. So we can keep our doors open and communicate office to office and be very separated, but have that water cooler talk. That's really been neat. At the end of the day, one of our wellness people does a just wonderful, soothing, zen, mindful meditation. So I put in my earbuds and I kick back. Maybe I do work. Usually I just close my eyes, and it's a wonderful way to end the day, at least here. And then once a week on Fridays, my academic school back at Arizona State, School for the Future of Innovation in Society, has been doing a digital coffee house. So imagine a coffee house from like the 1960s with the beatniks and all of that. And we just do the funnest, most silly things. And a lot of times, like back in the coffee house days, instead of people clapping that we often do, we'll do finger snapping and just yeah, right, bring on the silliness. And I'll be honest, Friday afternoons, it's been a godsend. It's been glorious to end my weeks that way.
Great. Yeah, I've really found for myself having things to look forward to, having things that I'm excited about during the week, even if it's just one thing, getting outside for a walk with a friend, has been really nourishing for me as well. So before we launch into the Q&A here, first off, thank you to all our panelists for all the preparation they've done here. They're going to keep answering your questions. I'd like to appreciate all of you, our attendees, for answering so many questions, and also for the folks who are voting up comments that they like and answering other people's questions. I love the back and forth here. We're definitely not going to have time to get to all of these, but I'm going to work to make sure that these questions are somehow made available to everybody for more discussion and more follow-up. So I'm launching a quick poll here just to gauge interest in future webinars. We have a few coming up. I'd really love to have this webinar series continue, and for that to happen, I mean, they're called the Community Webinar Series for a reason. Getting feedback from all of you in terms of what subjects you're interested in and whether you'd be interested in a panelist are going to be extremely helpful in having more of these going forwards, especially panelists. If you're interested, go ahead. If you hit yes, I can reach out to you and we can see what might work out in terms of scheduling. If you have a webinar idea, feel free to hit that button and I'll be able to find you and just get your information, your ideas. And we'll leave this up for a little while to give everybody a chance to think and respond. And with that, I'm gonna again remind everybody you've got that nice Q&A button down in your menu bar, and you can go in and respond to other people's questions. You don't have to wait for us to answer one. If you see one you think is really interesting, you can start that conversation yourself. And also to our panelists, of course, feel free. You should be able to pop out the Q&A bar yourselves and take a look through and address any that you find interesting. Just to get to the highest one we have here that doesn't seem to have quite as much activity. One question is about using goggles and face shields instead of masks in lab. So Kristen Dawes here is wondering that she's worried that the masks may fall down and that students may touch or fiddle with them, and that could become a safety hazard as well. And I'm also gonna do one quick thing. So just for the recording purposes, I'm not actually sure if our screen is recording these panelists. So I'm gonna move everybody up here and we'll see. I'll resize this window and just block the least important face. Great. And let's go ahead and kick that over to our panelists. So what about using goggles and face shields instead of masks in lab? Is that something that you've thought about or considered or using, thrown out?
Yeah, I think, I'm sure everyone's dealing with, massive PPE shortages. So we've tried to mitigate that risk however we possibly can. And, there's definitely a lot of face shields available. Face shields have been seemingly more prevalent. So we've been trying to do that and, reduce that potential for, spray whenever possible. So we've had to do it a few situations, but it's just a very real situation to evolve with the PPE.
Yeah,
Sylvie, have you had, oh, sorry, go ahead.
No, it's okay. For us, we're dividing up. So the cloth face covering, we're under an order, county order to wear them. So if we have a single researcher in a lab, it's obviously not an issue for the cloth face covering. Whereas if now we have more than one in a space, it is an issue, right? So that's not really PPE. The goggles and face shields obviously are PPE. That said, however, we had one operation that went through our approval process, and we did give it approval, but there was one thing that the mechanics of it and the weight of it actually required 2 people to be in close proximity. And so there we said, we really want to make sure that those cloth face coverings or other, if they happen to have an N95 already, they could feel free to wear that instead. But we also talked about the use of the face shields to augment, to supplement the cloth face coverings additionally. Everything in these cases is very imperfect. We recognize that, but we're just trying to continuously minimize the degree of spit, basically.
Of course. Great. So here's another question here from Lisa. A question to the panel, specifically Sylvie. The COVID task force that you mentioned, and the researchers that were informed by the group twice a week. Could you speak a little bit about when that group formed? And Lisa was wondering how long that group has been active, and maybe even building off of that, whether you found there have been any changes to the structure or the types of conversations that have happened as the group has gone on. So just piggybacking off your question there, Lisa, I loved it.
So basically, we had this pandemic plan, and on this group, on the plan, there was only like 5 of us. So there was like facility, HR, communication, safety people. And so we started our discussion back in January when we didn't even know if it was going to be a pandemic or not. So we just basically put the plan back into action, and we're starting like conversation. And when it became a pandemic, we're starting to have a little bit more like, at the beginning it was like once every, January maybe we discussed twice, and then in February we're starting to discuss once a week. And then in March, when really we're starting to know that it's going to be like we need to do more, we added some more people on it. So then we added more people basically, and now we're like 10 on it. And then when we have to shut down, the order was like to have March 20, something like that. Then we are meeting, we're still discussing now every other day. So at the beginning it was like every day, and then every other day. So and then when we talk, we decide according, okay, is it going to be something new, or can we skip like a day or 2? So like now it's only twice a week for this week. So that's the pandemic committee. So that's what we call the task force. And then about 3 weeks ago, when we found out that we may be able to ramp up, or we have more labs wanted to do more COVID-19 related research, we needed to have also the opinion of the PI. So that's when this task force from just the faculty started. And they only had like 3 or 4 times that they met. And then one of the faculty who is basically leading that task force kind of joined also the other force. So then we have also another person that will be on both task force. So it's been going on since, really starting in January, but it's been ramped up in March, and then we're like dealing with it like all the time now. I hope that answered the question.
Yeah, absolutely. Great. And going on here, looking down this line, we have a question from Mary here. She's curious about how you deal with lone workers. Jack, is this something that you've had to deal with in your own work managing safety?
Yeah, certainly. Even when I was a researcher, I'm sure any of you who have been in the past know that 10 p.m. experiments are not something that you can avoid sometimes. But I kind of leaned on some of my research experience to help inform the staff as to how they should communicate with the current researchers. And I've actually personally communicated with some of the current researchers on methods that they can use to set up something like a buddy system for lone workers, even if they're going in for just an hour or if they're going to be there all day. there's been some variations, of course, but for the most part, what it comes down to is, first of all, figuring out if there's a building manager on site who can be sort of like the go-to person in case, the buddy for the researcher can't reach them. The buddy, doesn't necessarily have to come onto campus. What they can do is they can keep, a 15-minute or 30-minute, whatever, however periodical you want it to be, check-in system where, they either text each other or they call each other to confirm that, things are going well. We've had labs asking about, setting up cameras in their space and stuff, but for the most part, we've been directing them towards more of just a continuous and periodic communication with each other, and then, if necessary, with other like facilities or building managers in that location.
Fantastic. Is anybody taking a different approach to lone workers that you'd like to speak on quickly before we move on to our next question? Great. Well, the next one here we have is from, let me just take a quick look here. It looks like Ralph Stewart. Let me find out where that one went off to. Here we go. So yeah, Ralph was wondering if you've considered using tracking, who is in the lab and when, to support contact tracking in case somebody turns up who is infected. So definitely contact tracking and contact tracing really on everybody's minds right now, especially as we consider ramp up, which is going to be the topic of our next webinar happening next week on Thursday. So Sean, did you have any thoughts here? And I think John, you also had a response as well.
Yeah, we try to enforce contact tracing and presence here as much as possible as part of our sort of emergency operations guidelines. So we've had all the laboratories set up some form of a shared spreadsheet where they could document who's going to be where and when. We're trying to do some sort of shift work to try to maintain, a strong ability to physically distance in these laboratories. They're very tight areas. So that's been pretty successful to sort of know where people are, know when they are in certain areas. And along those lines too, it's helped us better cater, our security walkthroughs. That's been one piece too, where to Jack's point with the lone worker piece too, we've been trying to sort of make sure that our security patrols are hitting areas where people are active and where people are going to be at certain time periods. That way, even if we do have a person, these labs are large. So if we have one person in one area and they're relatively isolated, at least they're on someone's radar and they're able to sort of walk through and track those areas. And we've been doing something a little more diligently with the high containment labs. We try to keep a buddy roll at all times too in those situations, but we're trying to make sure even in that case, we're documenting where those people are and when they're going in these areas, and just trying to keep an idea of where people are and when they are, and making sure that we can do that for contact tracing, but also just for whereabouts of people during this crazy time.
Great.
So we have.
Oh, sorry, go ahead.
No, we also have, because we have keycard access to all the buildings. So when we have, if we have to do that, we can always get the record of who entered the building that day, or the days. And that's also we're kind of then say, okay, which area they could have been, and if they could have been in contact with a person that may be positive.
Great. And John, did you want to speak to the Google Calendar?
Yeah, sure. So our PIs tended to get together by department and decide what they were going to use, because a lot share labs, is some type of calendar, usually like a Google Calendar. And they used it two ways. One way was to make sure that there was this separation. And so the PI was always looking at the calendar, or requests would come in to the PI to make sure that there was this separation. And then furthermore, we would then have a way of doing contact tracing. Heaven forbid that became necessary.
Great. So let's get another one on here. I've got a question a little farther down from, looks like John, asking about ensuring that COVID-19 precautions are standardized throughout the campus, particularly a large campus, so there aren't discrepancies among different departmental college and guidance there. So just kind of wondering, again, that kind of standardization, especially if you've got a lot of people who you're getting, hopefully they're small enough that you can kind of address all of them at once, but who knows?
Well, for us at UCLA, which I guess you could consider that a large institution, there, any of the, campus-wide directives and instructions, posters, things like that are all going through our emergency operations center. So they have been meeting virtually daily, sometimes many times a day, working really, really hard to make sure that timely information comes out and that it's been vetted, that it matches with all the state, county, and local directives that we have to, abide by. So that happens to be, our, sort of our standardization method is to make sure that it's going through that process. And they're working closely with the various task forces that we have on hand that are either being organized to coordinate the ramp up, or that are currently working on, the essential research lab approval process. So that is kind of our central hub, and we have some really good people, not only from EH&S but throughout the organization, various roles that are doing great work.
Yeah, from my perspective as an embedded safety professional, I see it at both ends. So on the one hand, I'm checking in with our director of EH&S or our AVC of safety services or others, general counsel or whatever. And there's just a ton going on behind the scenes that I try to be at least a little bit aware of. Our people, similarly to Jack's, they're meeting all the time. They're trying to push this stuff out, but it's really a challenge to keep up. So I try, don't want to duplicate anything, don't want to step on anyone's toes, but if we need to come up with things to augment or supplement, or if they don't have something and they want to encourage us to come up with our own, then that's what we do. Then I see it from the other perspective. So I'm in the dean's office, and then I see what our chairs in our different departments are trying to come up with, and the PIs are trying to come up with. And so, looking to try to assist with some level of standardization. But again, for me, it's all about, is this being effective, right? So standardization has its upside, but it also has its downside as well. And so trying to be understanding and let people go in the direction that they need to. But at the same time, while we were talking, I actually got an email from one of the chairs asking me just actually about this point. Should we be doing this, John? Or is this something that you guys in the dean's office are taking care of? So again, really coming back to maintaining those open lines of communication so that people are not in a state of unknowing or doubt.
So just before we move on to a few more questions, I wanted to quickly give a plug to our other upcoming webinars. So we've got a few others coming up. Next week, we're having one focusing on communicating with leadership, ramp up and reopening checklists that's happening at the same time on Thursday, 3 to 4 p.m. After that, on 2 weeks from then, on June 4th, we're having one focusing on communicating with leadership, just tips and tricks for communication, how to do that well, especially when tensions are high. And we have a brand new one open right now for registration on our homepage. You can go there at BioRAFT.com, which will be a retrospective on coronavirus initial response. It's not often that you get to have all of our emergency plans be put into practice all at once. And if there is going to be a second peak, understanding what went well, what didn't, when the rubber met the road, might make it a little bit easier and less frenzied if anything just kind of goes belly up again. So again, please feel free to go ahead and register for those. I hope to see you next week. And with that, we'll get back to our Q&A here. Question here from Emily Browning. What are the recommendations regarding storage and laundering of lab coats in between lab sessions for microbiology and chemistry labs? I don't know if any of you are dealing with those right now or those situations, but lab coat workflow and storage, it sounds like, is a concern here.
I'm not.
Nope.
Our vendors are still servicing very appropriately for us, so we've been lucky in that respect as far as lab coats and reusable scrubs and things like that have occurred. So they put in processes to, deal with potentially contaminated material, both laboratory and personal, given the current situation, and they were able to adeptly deal with it appropriately. So we've been lucky.
Yeah. Great. Yeah, I think this is oh, Sylvie, you were going to say?
Yeah, just want to say that as a small institution, again, like, so we basically have like washer and dryer already like available to everyone in our institution. So then that's why they only use it for the lab coat. So we just set up a sign up. So then if we have more usages, like at least they don't go and wait, and then they can be separated. But I mean, we have no issue there either.
Yeah, our vendor is still on their normal laundry schedule. I mean, I think the same advice that we always give applies. If you think that your PPE is contaminated, then do not use it anymore and find a way to get it decontaminated, whatever type it is. So yeah, that's kind of we've been kind of holding the line there.
Yep.
We certainly have lab coats in our labs, but looking at the question, it said microbio and chem, so that's why I was trying to opt out of it. I don't have those in engineering.
Yeah. Emily, it sounds like if you have a particular concern or something there, maybe a few more details about the challenges you're facing would be really beneficial there, but otherwise using the laundering services, and it sounds like fortunately not too many things have changed there for at least our panelists. This is something that I actually really like about this series. It's not about having all the answers, it's about having discussions about the questions. So it could very well be that some of you have more experience with that, and please definitely encourage you to talk amongst each other here and get more answers out. So with that, we are at 4 p.m. This is when the webinar is scheduled to end. I haven't actually talked to any of the panelists about this yet, but if any of you have the free time and want to stay on for a little bit longer to keep going at this Q&A, we have so many questions that haven't been answered yet, and we're going to address those outside of the webinar. So feel free to go ahead and hop off, but otherwise I think we could probably spare another 15 minutes or so to keep chatting if anybody's still interested. And again, we have all these other webinars coming up, including one next week. We wanted to make sure this was a very topical subject and got addressed quickly. And then a brand new one available for login and registration, the retrospective on coronavirus initial response here. Great. So moving on, John would like to know if there are any suggestions for simple but informative lab door postings when entering and exiting the lab as it relates to COVID awareness. So anything that you guys have been posting in your spaces to help just kind of remind people of the important stuff.
Yeah, I could jump in on this one. We've had a lot of, obviously we had very long edicts to start with, and it's been translating that down to a more digestible format, then translating that down to a more digestible format. So what we've been trying to do is make these things as accessible, but also as quickly and easy to use. And I tell you, the old reliable, quick hitting phrases that, sort of have a little rhyming to them even sometimes. And then the wonderful little pictographs, just anything that sticks in someone's face. And then just putting those at eye level anywhere people sort of travel. So we can put them right outside elevators, the ends of hallways, doors, just things like that. So it sort of keeps reinforcing, it kind of keeps hitting them in the face. And it's like advertising, right? I think it's the really core key points. We have those big three, the social distancing, the masking, and the hand hygiene. And we've been really trying to hammer those home as much as possible.
Fantastic. Here's another question that speaks very near and dear to my heart as a past researcher. This was always a big challenge and something that we had to do in normal times. Mir would like to know, Mir, I hope you're pronouncing your name here correctly. Due to the current situation, some folks are using gloves to open doors, elevators, etc. Others working in labs use them for handling hazardous chemicals. As a safety professional, this seems like a nightmare. What advice would you give to your research folks to manage glove use, especially when you're touching doorknob handles on the inside of labs, on the outside of labs, to lab or non-lab spaces, touching all the buttons and everything? It's just, that's one that I've certainly run into plenty.
So I can step in just what we have planned to do. We just bought basically like 10,000 of these really cheap like clear gloves to use outside the laboratory. So then we know that they can have like different gloves, and then it's not like a lab glove. So try to make the difference. But I mean, again, we can do that because we're small enough. But this is what we went for, having a glove that doesn't look like a lab glove. So then there's no question.
Great. So yeah, shifting to a sort of a non-lab intermediate glove seems like a really nice way to strike that balance.
So, I mean, we come into this problem even in normal times, but now you have, a lot of folks probably thinking that if I wear gloves everywhere, whether I'm a researcher or member of the public, that I'll at least be protecting myself. But what it does is it creates an environment where you can't be sure what's the glove-free zone and what's the that could be contaminated and what's the zone that is supposed to be clean. And there's no substitute, in my opinion, and I think my colleagues will think the same, for the proper hand hygiene. I think that changing the glove policies in order to accommodate some I guess heightened awareness of touching public door handles and things like that is not the message we want to send. We want our researchers to be kind of like the models for the proper behavior, which is, clearly this is a glove-free zone, then you're not going to be using gloves. And what we recommend is, proper hand hygiene, not touching your face. If you've touched a publicly accessible doorknob or whatever, then that's your cue to, when you finally reach wherever you're going, to utilize hand washing techniques. In lieu of that, paper towel for a temporary, method to protect your hand, create a barrier at least, and let's say leaving the bathroom, allows you to, maintain some confidence that your hands are not contaminated as you move through, your workplace. I'll honestly say I haven't touched a doorknob in probably 6 weeks, using my elbows and all sorts of other methods, and we're encouraging our researchers to kind of maintain that separation when it comes to gloved and non-gloved areas.
All right, fantastic. Thanks for the great question there. And moving on here, we have a question from Miriam Sharp. She was curious about how others were managing communications in order to balance providing necessary guidance and not generating an overwhelming stream of emails. I think we're all getting pretty overwhelmed with this messaging, now more than ever, and just everything demanding your attention. Are you being allowed to message on demand, or do you need approval from higher administration to send stuff out? Do you coordinate with strategic communications or other divisions to craft unified messaging, and what's the frequency sweet spot? So it sounds like a little bit of permission, whether you're able to just message at your own discretion, and then also just judgment calls, what's over messaging, what's under messaging, and of course, making sure you find that sweet spot.
Yeah, our continuity team that I'm on for engineering includes the functions of safety, facilities, IT, communication, and administration. So I'm in touch with EHS and all of my counterparts. So our communications director is in touch with strategic communications. So we know, our team knows before stuff goes out what's about to go out. And we do try to be strategic about it as much as possible. Make sure it's a unified message. We all talk about it. And then our communications director will often be the one to push it out. But then at below that, we don't do a lot that goes out to every single person, and we work through the usual channels. So if stuff has to go to undergrads, it goes through advising. If we need to do stuff to faculty, we have a list. We reach out to the department. So there's a lot going on below the level, so that, yeah, you're right, we're not doing the tremendous everything going out at once, but doing things a little bit on an as needed basis additionally.
I think to add to that too, we have a huge edict from our healthcare network. So we get a lot of notifications to the healthcare network at large. So we're getting messages all the time about this type of patient handling guideline, this part of, this healthcare setting guideline. So the good part that's actually benefited me from a research safety standpoint is, the researchers have definitely built their own little filter for those emails because there's so many of them, and there becomes a mentality of, oh, this doesn't apply to me. But it's given me an avenue to sort of translate the important pieces and how they apply to them, while also tackling, this important safety aspects of what's currently going. And, I completely agree that trying not to saturate the information channels. I feel like I could send, communications emails, 3 times a day, and, at some point it's going to fall on deaf ears. But it's a matter of trying to make sure that, translate the important parts in a digestible format for the researchers, but also to make sure that, they're looking for those messages when they come from myself and from safety here, to make sure that, that's appropriate communications and it's communications they need for what they're doing. And I think that's helped a lot.
Yeah, I agree also that we realized that even though we were only doing like twice or 3 times a week, like with like all the county information and everything, it was too much. So just before we ramp up, we prepared like a safety presentation, if you want, so that summarized everything that the most important thing that they need to have. And we asked the faculty to make sure that all their staff will read it before they come back to work. And that was helpful because that's when we got really questioned about what we were talking about. Before that, they were just like, okay, too many emails. I'm not going to read it again.
Yeah, and in my role as a EH&S safety professional, I got to make sure I stay in the appropriate lane. There's certain interpretations of broad campus policy that you want to have the official word out before you communicate what that means to the individual researcher. However, I look at it analogous to how we our relationship with regulations, right? We don't expect every researcher to know every regulation. That would be burdensome and they'd never have time to do research. However, it's part of our job to interpret those and make them relevant and applicable to the researcher. And so we take the same approach with the larger campus directives that are coming down from our strategic communications. And then when it comes to our wheelhouse, which is risk assessment and safety management within these laboratory spaces, I think if it's not specifically tied to one of these policies under development, that we reserve the right to give them our best recommendations and to try to push them in the right direction of reducing risk, because ultimately we are the experts on that.
Great. It looks like a top comment here right now is a question about using N95s for job tasks requiring individuals to be within 6 feet of each other, as opposed to just the sort of default face cloth covering that we use for those larger aerosols. There are those tasks where you do just need to have those people in close proximity more than they might want to normally be otherwise. Is N95 something that you have on your radar as part of the PPE for that type of equipment or that situation, or do you have a different plan? Or are you trying to avoid those types of situations altogether?
We're trying to avoid them altogether. Getting N95s, using N95s, it's really problematic. I mentioned before in that one special situation where 2 people had to be working on the same thing because of the weight, size, scope, and they're building it, that they had to. We tried to come up with other ways. All of that said, on a case-by-case basis, if something rises to that level and we're not robbing Peter to pay Paul, we'll look at those, but we're really trying to minimize that as much as possible. And it's not an alternative to, I want to have this operation run at the same time as this operation running. That just doesn't seem to rise to that level.
Yeah, and honestly, from a logistical standpoint, we've essentially run out of N95s. I think that would be the other thing too. Is I think at the beginning of this, we had people that were fit tested for, one make and model that was quickly gone, and then we had to pivot to another and pivot to another one. It became we were sort of chasing our tails in the whole situation. So the ways we try to mitigate that is, we've tried to avoid the situations as much as possible. Plexiglass spray guards, sneeze guards, where we can put those up. We have a few of those lingering around. We try to emphasize as much space as we can, but it's a difficult task, and it's something that we've had a lot of struggles with. So, we've had some success for sure, but it's definitely a shifting target. And even in places where traditionally N95s were utilized in our facility, we've had to opt to PAPRs. We've actually had an overabundance of PAPRs because of all of our containment facilities. We were able to redeploy those in a few places where we would have used N95s. So it's definitely been it's a tough task for us.
Yeah, all of our N95s are with healthcare workers, so
Mm-hmm.
we
Exactly.
have to prioritize.
Yeah, and just a quick follow-up question here. I guess it's we can definitely wrap up. So looks like we're running out of time here, and I know that a lot of people are thinking about KN95s as well. It's something that I've heard several people talk about, and you can just consider those. But it sounds like right now the prevention portion of the sort of hierarchy of controls is the place to really be looking for these sorts of situations, and thinking outside the box of how you can avoid those situations where you might need to have people be in close proximity. And with that, I think we can wrap up here. I'd just like to thank all of our panelists so much for their time and effort, jumping on this first webinar and really kicking things off with a bang. I appreciate all of your time, and I'm sure if we had everybody unmuted, you'd be hearing quite a lot of applause here. So let's get some thanks in chat for these guys, and excited to see everybody. Oh yeah, got a lot of people raising their hand. That's great. And we're going to see everybody next week for our Ramp Up Reopen checklist webinar. We're going to have a new panel of people all on to talk about their thoughts there. And then we've got another, again, these 2 new ones coming up, including this brand new one that we just debuted during this event. So thank you, everybody. So glad to have you here. Feel free to send over any feedback about how you like this one. And I will see everybody later. Thanks to our panelists again.
Thanks, Matt.
Thank you, everybody.
Bye.
Stay safe, everyone.
Yeah, stay safe.
Pleasure.
And sane.
Stay safe.
Take care.
Thanks. Bye.